Dr. Rajini, and today I'm going to talk about a very common aesthetic concern for skin of color patients, and that is dark circles. Dark circles is highly distressing for this group of patients, especially because it is highly visible and makes one look dull and tired. Now, what is dark circles? Dark circles are black or brown patches which are mostly in the lower eyelid, but they can extend into the upper eyelid. They can also extend into the upper cheek, also into the inner part of the nasal wall. Now, there are many causes for dark circles and the treatment depends on the cause. And this requires an evaluation by an experienced cosmetic doctor, dermatologist, or plastic surgeon. So now I'm going to go through the causes and then the treatments. So the causes include constitutional or hereditary. This is where it is present in the family. It starts in early childhood. They already have deep set eyes, and as they hit puberty, it starts to become more noticeable. And then we've got post-inflammatory. That is due to skin disease in that area. So it could be just simple eczema. It could be allergic contact dermatitis, allergic to certain products. It could be specific pigmented disorders such as lichen planus pigmentosus, acidermatosis, or it could be as simple as rubbing, dry skin and rubbing in that area that leads to dark circles. And then we've got what is called vascular, or this is where the blood vessels become more prominent. This is when the skin becomes thin in that area, the veins are more prominent, and this gives a bluish reddish discoloration. Then we've got what we call a shadow effect. There's a hollow in the lower eyelid, and this is also called a deep tear trough, and this is mainly because of aging. When there is aging in that area, there is a loss of volume, there's loss of the fat in that area, and there's also loss in collagen in the skin, which makes the skin thin. There is resorption of the bones. All that leads to hollow under the eye. And there's also fat that moves downwards, and that forms a little wall, and that increases the shadow. Then we've got some pigmentary disorders called pigment demarcation line, which is physiological pigmentation. And this is not due to any external cause, but it is just from inside. Here, there's pigmentation in the form of a V or a W in this area, and then that extends into the lower eyelid, causing pigmentation. Some other congenital conditions such as Hori's nevus, nevus of Ota, these also cause deep pigmentation in the skin. So that's called dermal pigmentation. And then we've got swelling around the eyes called periorbital edema. These are due to certain medical causes, and here the swelling is more prominent in the morning. Certain drugs can also increase pigmentation around the eyes, such as those eye drops that are used to treat glaucoma. Then we've got oral contraceptive pills, HRT, and then nutritional deficiencies. So deficiency of vitamin B12, anemia, all this also can cause dark circles, and these are correctable. In a large study from India, where 200 patients presenting with dark circles were analyzed, it was found that at least 40 to 50% of the cause of dark circles is anemia. And then we've got lifestyle. So those with lack of sleep, that can also increase the blood vessels appearing under the eyes, and that increases dark circles. And I've noticed that myself when I've had some deadlines and I've not slept enough, dark circles have increased. And then when I compensate with better sleep, then that becomes normal. Therefore, adequate sleep. So there's no prescription of 8 hours or 10 hours. It is just what your body needs. What makes you wake up fresh. That is adequate sleep. That is important. Stress, which is there in everyday life, but that also unfortunately increases the dark circles, and it can be due to stimulation of melanocyte stimulating hormone through an axis called HP axis. So trying to minimize stress as much as possible. Obviously, it's easier said than done. But even things like yoga, meditation, mindfulness, whatever it takes to be able to face and deal with daily stress will help. Then we've got cosmetics. People can develop allergy to cosmetics after using them for many years. And this is a cause for itching in that area, dryness again, inflammation, rubbing, all that can increase dark circles.